Hello mga abangers! Hello mga fab! Good day to you everyone. Good day everyone! Welcome to our vlog. Welcome to Nurse Jose. And of course, today is a brand new episode of this channel. And of course, we'll be talking about a very special topic which is all about common board questions regarding the classical symptoms or classical signs and symptoms of diabetes mellitus. So what we'll talk about is either the 4 P's or the 3 P's of diabetes mellitus. But before that, if you are new to this channel, please don't forget to hit the subscribe button. At the same time, please also don't forget to click the notification bell for you to be notified with the succeeding uploads of this channel. And also, if you like this video, please don't forget to hit the like button. And if you have something to say, please comment down below. Okay, so shall we start? Okay, we'll talk about now the diabetes mellitus, but of course this diabetes mellitus is gonna be it's not gonna be thoroughly being discussed, but we'll focus now on the signs and symptoms of diabetes mellitus. But before that, let me share to you what is diabetes mellitus. So when we say diabetes mellitus, it means that you focus more on a problem of your pancreas, wherein the pancreas is actually having problems with the production of insulin, or there might actually be normal insulin production, but there is gonna be resistance to insulin function. Okay, so we have two classifications of diabetes mellitus. So we have your type 1 diabetes mellitus. This type 1 diabetes mellitus is also known as your insulin-dependent diabetes mellitus. So when we say insulin-dependent, it means that there is a need for insulin for the body to function. And then of course, type 2 diabetes mellitus is your non-insulin dependent diabetes mellitus, wherein this patient is actually depending not for insulin, but sometimes this patient is requiring your oral hypoglycemic agents to function properly. Okay, so that is gonna be the definition of your diabetes mellitus. So when you say diabetes mellitus, it means that there is an error of the metabolism of carbohydrates resulting into presence of hyperglycemia. So when we say hyperglycemia, it means that there is a higher level of glucose in the blood. From the word hyper, it means it's increased, and glycemia is glucose in the blood. So therefore, if this patient is actually having a high level of glucose in the blood, so what will happen is there is an occurrence of the signs and symptoms of diabetes mellitus. And in that, we have 4 P's for type 1 diabetes mellitus and 3 P's for type 2 diabetes mellitus. Let's focus now on the 4 P's. So when we talk about the 4 P's of diabetes mellitus, let's begin with the first one. When you talk about your first P, the first P is your polydipthia. So say polydipthia is basically being defined as excessive thirst. When we say excessive thirst, it means that uhaw na uhaw yung katawan mo. Uhaw na uhaw sa tubig yung katawan mo, because there is an occurrence of cell dehydration. So when we say cell dehydration, it means that there is a problem with fluid inside the cell. Anong dahilan? Bakit meron siyang cell dehydration? It's because glucose is having this osmotic pressure. So we say osmotic pressure, it means that the glucose will draw fluid from the cell. When we say draw fluid from the cell, it means that what will happen to the cell? There will then be deficient in fluid. So therefore, there is this what you call cell dehydration. So that is the common question in the board. There is a presence of cell dehydration. So that's going to be very important for us to remember. So if there will be cell dehydration, it's actually going to be part of our negative feedback mechanism to signal the brain that there's a need for more water. So therefore, the brain will actually going to tell you, drink more, drink more. So that's going to be one way of responding your polydipthia. Let's now have the second one, which is going to be your polyuria. When I say polyuria, that's gonna be excessive urination. So say excessive urination, ihi ka ng ihi, ihi ka ng ihi. So the main reason why there is presence of excessive urination is it's because, as what I mentioned earlier, your glucose exerts your osmotic pressure. So when you say exerts your osmotic pressure, it means that there is gonna be a possibility that the glucose will also gonna exert the fluid, and it will pass through the kidney, and the result of that one is gonna be presence of glucosuria. There will be presence of glucose in the urine, and of course, excessive urination is actually expected. So the reason for your polyuria is gonna be your osmotic diuresis. So we say osmotic diuresis means that is brought about by the presence of glucose that will actually pull water, and of course the water will actually going to be passing through the kidney, and of course that will be eliminated into the urine. So just remember the first one, polydipthia, the reason is going to be cell dehydration. And of course the second one, which is all about your polyuria, the reason is going to be your osmotic diuresis. Next, let's talk about now your polyphagia. When we talk about polyphagia, it means that there's gonna be excessive hunger. So, gutom na gutom yung pasyente. So, of course, when you talk about this one, it will be very important for us to take into consideration that we have to give appropriate diet for our patient. So, the reason for your polyphagia, it's because of your cell starvation. So, when you say cell starvation, it means that gutom na gutom yung cell natin kasi walang pumapasok na glucose. Hindi makapasok yung glucose doon sa loob ng katawan ng pasyente. So therefore, it is very important for us to take into consideration that we are going to give nutrients to our patient. So the thing that you need to do when there is going to be cell starvation is you have to provide something that will actually let the patient eliminate the existence or the emergence of being hungry. So in that case, just remember the third one, which is all about your polyphagia. There is this what you call cell starvation. The fourth one is presence of weight loss. So you see presence of weight loss, the reason of that one is your cell catabolism. So you see cell catabolism, we've mentioned before that when you say there is catabolism, there is this what you call breakdown of nutrients into pieces. So therefore, there is going to be stored nutrients in the liver, there's stored nutrients in our muscles, or whatever stored nutrients can actually be utilized by our cell for the cell to function. So that is going to result into presence of weight loss. So just remember the 4 P's of type 1 diabetes mellitus. We have your polydipthia. The cause of your polydipthia is your cell starvation or cell dehydration. Just remember that. That's common in the board examination. Next, we have your polyuria. The reason for your polyuria is your osmotic diuresis. And of course, next we have your polyphagia. The main reason for your polyphagia is going to be your cell starvation. So gutom na gutom yung cell. And of course, the fourth one, which is your presence of weight loss. The main reason of that one is because of your cell catabolism. So these 4 are basically the hallmark symptoms or hallmark signs and symptoms for type 1 diabetes mellitus. Let's proceed now to the 3 P's for type 2 diabetes. Which is actually lacking for your type 2 diabetes is there's no presence of weight loss. So the patient with type 2 diabetes mellitus is actually manifesting obesity. There's presence of weight gain. It's because type 2 diabetes mellitus is actually associated with obesity or lifestyle that is actually brought about by overeating. Okay, so when you talk about type 2 diabetes mellitus, our focus is all about understanding these 3 P's. And it's actually the same as with your type 1 where there's gonna be presence of polydipthia, there's presence of polyuria, and also there's presence of polyphagia. Just remember that in your type 2 diabetes mellitus, 3 P's only: polydipthia, polyuria, and polyphagia. For your type 1 diabetes mellitus, we have 4 P's: polydipthia, polyuria, polyphagia, and presence of weight loss. So just remember also that when you're talking about these classical symptoms of diabetes mellitus, it is very important for us to remember that we know what is the reason why there is actually an occurrence of this one. So just remember, when there is polydipthia, the reason of that one is because of cell dehydration. Just remember that, cell dehydration. And of course, if there will be presence of polyuria, the reason for presence of polyuria is because of osmotic diuresis. So the osmotic diuresis is the one that causes your polyuria. Next, we have your polyphagia. And the reason for your polyphagia is gonna be your cell starvation. So gutom na gutom yung cell natin. So therefore, it's very important for us to take into consideration that we are going to address that. Next is presence of weight loss. So we say presence of weight loss, there's gonna be, the reason of that one is gonna be cell catabolism. So don't forget those. Just remember, for type 1 diabetes mellitus, 4 P's. For type 2 diabetes mellitus, 3 P's. Okay? And also for management of diabetes mellitus, you have to remember only 3 things. And of course, a mnemonic is DIE. Diet modification. Next is insulin management. At the same time, of course, you have to have your exercise. Just remember that. We have to remember that one way of managing patients with diabetes mellitus is diet modification, insulin management, and also for your exercise program. Okay? So that is it Thank you so much for your continued support. I hope that you're going to that we are going to see each other once again in our next vlog. And of course, if you like this video, please don't forget to hit the like button. And of course, if you also want your friends to know, please don't forget to share this video to them. And also, if you want something to share, if you want something to talk about, please comment down below. And of course, if you're new to this channel, please don't forget to hit the subscribe button and also the notification bell for you to be updated with the succeeding uploads of this channel. This has been Nurse Jose at your service to make your best even better. Thank you. See you again. Bye.